Streaming live on WFLA Now. Powered by 1-800-ASK-GARY.
The latest on what we know this morning on COVID-19, also known as the coronavirus. Not too much has changed since that yesterday evening. 2 coronavirus cases confirmed here in the Tampa Bay area in Manatee and Hillsborough counties. That's important to note. They are confirmed. They have been confirmed by the CDC. Those cases were originally presumptive positives. Now they are officially positive. We also learned last night that the Hillsborough County woman in her 20s who tested positive for the virus after a trip to northern Italy traveled through Tampa International Airport. Good morning, everybody. I'm digital reporter Daisy Ruth, and this morning I am joined by Dr. Juan Dumois, a pediatric infectious disease specialist at Johns Hopkins All Children's Hospital. Thank you so much for joining us, Dr.
You're welcome.
Bring you in here. So I know you spoke with my colleague Serafina Brooks yesterday regarding coronavirus in children. We have been getting a ton of questions from concerned parents. What can you tell us about coronavirus in kids?
Well, one of the most important things about coronavirus in kids is that it seems to be affecting them a lot less than adults. It seems that kids are not ill as frequently, and when they do get sick with it, it's much milder than what the adults get. So the numbers are dramatically lower than what we're seeing in adults across the world.
Now, Doctor, why do you think that is? That's a very surprising thing to me. Obviously, I'm not a doctor. You think kids would be someone susceptible if they're at school, touching their face, not washing their hands. Why is that?
Yeah, for a lot of viruses that we see infecting kids, the younger the kids are, the more susceptible they are. And it seems that the lack of a mature immune system may be a factor for little kids under a year of age or so. But there are some viruses, like this one, where the younger children tend to have no symptoms at all. So the kids are probably getting infected. They may actually be spreading it to the adults in their home, but they just don't get sick as much, or they just get a very mild cold.
So we've been talking a lot about prevention. What are some of your best, anything you can give as an advice? We've been talking about hand washing, about not touching your face. I learned a lot yesterday about how much I actually touch my face without realizing it. What can you tell us about prevention?
A lot of people think about getting masks and putting masks on their kids or wearing masks out in public as if that's going to protect them. But transmission through the air directly to your face is not nearly as common as touching an object that's contaminated with virus. So masks will not protect you most of the time. Just think about how often can you think of someone coughing directly in your face compared to how often do you touch objects out in public when you go to the grocery store or to a restaurant? There's a big difference there. So you really have to focus on cleaning your hands before you touch your face. And like you said, we have a lot of unconscious habits of touching your face, whether it's adjusting glasses or just rubbing your nose or just resting your face in your hands. Those are ways that you can infect yourself with viruses that you picked up from the objects you just touched a few minutes before. So if you can become conscious of your face-touching habits and then clean your hands before touching your face with either soap and running water or an alcohol-based hand sanitizer, you will not catch anything.
So it's obviously allergy season here in Florida as well. If you're somebody like me with allergies, my eyes are starting to itch, I should wash my hands before kind of scratching my eyes, rubbing my eyes, and then after is what you're saying to me.
Oh, definitely. Yeah, for people with allergies, you're going to want to rub your nose or sneeze into your hands, and you really just need to clean your hands right afterwards, but also right before if you can.
So you answered one of the questions that I had and what we've been seeing a lot of here on WFLA Now, asking about the masks. Another question, I had posed a question on Twitter asking folks to send us in what they were curious about with the virus. Is it necessary for relatively healthy people who contract COVID-19 to be hospitalized, or can symptoms be managed in self-isolation? And can you talk about that in children as well?
Yeah, the vast majority of people who are infected with this virus should not be hospitalized. You don't get hospitalized just to be quarantined. There aren't enough hospital beds in the country to do that. So most people will be diagnosed, sent home, and you'll be given instructions on how to deal with it as if you had the flu, except there's no antiviral drug that they'll give you, like they can give you an antiviral for the flu. The people who do have to be hospitalized are sicker. They may have pneumonia. They may have a need for oxygen that can only be administered in the hospital. And some of the older people who get infected with this virus get much sicker and have to be managed in an intensive care unit.
So this was a question I didn't think about that I had gotten yesterday on Twitter. Coronavirus is obviously a virus, and we have some viruses like mono that once you have it for life. Is COVID-19 something like that? If you get it once, can you get it again?
So that's actually two questions. When you get COVID-19 virus, you do not keep it for life. You get sick, you get over it, and then the virus is gone. But then the second question is, can you get it again? Do you have immunity that protects you from getting this virus later on? Maybe if it's coming around next year during the winter virus season, can you get it again? And we don't have those answers yet. We will get those answers over the next few months as they start testing people who have already had the disease, they've recovered, and they're going to check their immunity. And they're going to keep checking their immunity over the next couple of years to see how long that protection lasts.
Now, another big question that we had, kind of unrelated, big events. There are some local governments and places where we are seeing this virus advising against large congregations of people. We have a lot of that here. We're going to have WrestleMania here next month. We have Lightning games. We have Vipers games now. What's your advice on someone wanting to attend one of these events? And are you one of those people who believe we should limit those?
Regarding whether to limit the events, that requires a careful calculation between the event organizers and the public health department. It requires considering how much coronavirus is in the community, how big is the event, and where are the attendees likely coming from. So if it's a local event that won't necessarily attract a lot of international attendees, that's very different than, say, an international business conference where people will be coming in from all over the world. So that calculus is going to be quite different. If you want to attend one of these events that has not been canceled, then you want to be conscious of the fact that people may be near you that are coughing, and you may not have control over whether you can get farther away from that person who's coughing. You should bring with you hand sanitizer in case soap and water is not handy. You should use that hand sanitizer whenever you touch something. If you've just ordered food or a drink, you may have been gotten some virus on your hands from the person who just handed you that food or drink. So just use that hand sanitizer. If you have to do it 20 times during the course of the event, that may not be too much. You don't necessarily have to wear a mask, although for people who travel, like on a plane or a bus or a train, you may want to consider bringing a mask to wear if you get stuck sitting next to someone who's coughing, because there may be some airborne transmission if you're within 5 feet or so of the person who's coughing. That may also apply to some of these big events.
Doctor, we actually just got a question in from WFLA now viewer Mary. Can you please address how this compares to the flu season? That's something else we've been seeing a lot about, more people dying from the flu than coronavirus. Can you address that in adults and also in children for our parents watching?
That is an excellent question, because with all the concern and fear about coronavirus, it seems that often people forget about the flu. So to get it into perspective, so far this year in the United States, for this flu season, it's estimated that about 18,000 Americans have already died. There have probably been over 32 million cases of flu in the United States. That is far outpacing what we've seen with coronavirus and what we're likely to see with coronavirus. In China, there have been over 3,000 deaths, but in a typical flu year in China, 88,000 people die of the flu every year. So I think that the flu is a much bigger concern. There are a lot of people who feel that the flu is no big deal until it affects them or their family with a very severe case that puts them in the hospital or kills one of their family members. They may not think that getting the flu vaccine is important, but I think that the flu vaccine is quite important. And especially now with the coronavirus coming, you can get the flu and coronavirus at the same time. That may not be a good combination, so you really should get the flu vaccine.
Now, this is something I would think we need to talk a little bit about more across the board in our coronavirus coverage. What should people have on hand? I'm seeing a lot of comments now about Sam's Club being out of hand sanitizer, out of water. What should people have on hand? I've seen things like things to reduce fevers, sanitizer, obviously, water. What should people have on hand? Should we prepare like a hurricane season? What should we be doing?
So I think that it would be practical to get some kind of hand sanitizer. Some of the types of hand sanitizer have sold out in some of the local stores, and until they restock, you may have to shop somewhere else that has other versions of hand sanitizer. I did mention that hand sanitizer that contains alcohol, especially at least 60% alcohol, is the best. There are some other types of hand sanitizer that do not contain alcohol. They may not be quite as effective, but they are better than not doing any hand cleaning at all. So you can get those temporarily until stores have restocked with the alcohol-containing hand sanitizer. If you do get sick, whether it's with the flu or with coronavirus, you're going to manage the symptoms as if you have a bad cold or even a mild cold. So it's a good idea to have on hand some ibuprofen, which is sometimes called Advil or Motrin, acetaminophen, which is Tylenol by one brand. You may want to have those on hand to make you feel better from the aches, pains, and fevers. Some cough medicine that you would be also good to have on hand and not wait until you're sick to have to buy it, because nobody wants to have to go out when they're sick.
Right. So this is a question that I have. I don't know if you've got the chance to listen to any of Governor DeSantis's press conferences yesterday, but we do have a testing center that is open or going to be open here in Tampa. And the governor mentioned we will more than likely be seeing more of these cases. Do you think we'll see any new presumptive cases today with the timing of how things are tested now? I believe it's a 24-hour test, and we haven't heard anything yesterday.
I think that it's very likely we could hear about new positive test results on a daily basis, just by what we know about how easily this virus spreads. Since the criteria for who can be tested were loosened up last Friday, we may see more doctors ordering tests on more patients on whom they could not order tests last week.
Now, do you know what those tests entail? Is it a blood test? Is it a swab? What's the coronavirus test like compared to the flu test?
So it's usually going to be a swab of secretions coming from somebody's nose. And in that test, they are trying to detect the virus itself. And that's what takes about a day.
So we have some comments coming in here right now. We have someone saying that Japan just announced asthma drugs can reduce symptoms of COVID-19. What's your take? I'm not sure if that is correct, but I have been seeing questions of, are people with asthma more susceptible to this respiratory disease?
So asthma drugs will help people with asthma who are infected with any virus, because for many people with asthma, a viral infection of the respiratory tract or the lungs will trigger their asthma. So yes, asthma drugs will make them feel better because it's treating the asthma that has flared up in response to the virus. People with asthma are more susceptible to coronavirus as they are to flu and any other respiratory virus.
Getting a lot of comments in about folks who are stocking up on their hand sanitizer. Guys, that is excellent. If you have any questions, please go ahead and leave them in the comments. We have a question about, are you shutting schools down? What are your thoughts on that? How bad does it have to be? We've been getting a lot of comments from parents about this. At what point do our schools need to be shut down, in your opinion?
So shutting down schools is usually going to be a decision made between the health department and the local schools or school board. It will depend upon what kind of virus activity is seen in specific schools. They likely would not shut down all schools unless it's a community-wide outbreak. Individual schools may get closed. Often it's closure for a few days just to clean objects around the school.
Right.
One of the main factors that may lead to a school closing is just the recording of information that a lot of children have been specifically infected with this virus, suggesting that there's a lot of transmission of the virus occurring in the school. So they may close the school for a certain number of days to try to break that transmission cycle.
Right. So we have another comment here from top fan Debbie Hall. She says, or Jennifer Marie, I apologize, early summer would probably slow it down. And that's something that has been in the news media with the president's comments about the weather slowing down the virus. Is that something that is actually scientifically proven? Is the warm weather going to help it? Do we need a cold spell? What environmentally could help this?
So warming weather slowing down this outbreak has not been scientifically proven. And unfortunately, the only thing that's going to prove that is when the weather warms up, we see what happens. So we can try to predict based upon other respiratory viruses that, yeah, for a lot of viruses, things do slow down a little bit as the weather becomes warmer and more humid. It seems that humidity may be a factor, not about how the virus affects us, but how susceptible we are to viruses. Drier air dries out our nose, and it seems that having more moisture in your nose helps protect you from viral infections than having a dried out nose. So that may be one factor of why we see more viral transmission in colder weather, because it's also drier air.
So this is another question that we got from Alicia Izell. What exactly can a normal person do to prevent catching the coronavirus? And we have talked about this within the stream, but I think it's an important thing to reiterate, Dr.
Oh yeah, definitely. So what a normal person going to work, going about outside their home would want to do to try to avoid getting the coronavirus is just be cognizant of the fact that anything outside your home that you touch may be infected with somebody else's virus, because especially if it's something that is touched frequently, whether it's a doorknob or the handle on something, or buttons that you push on some device on a vending machine. Now, if you get virus on your hands, you're not going to get sick. You have to, again, be conscious that you may have virus on your hands from the things you've touched. Clean those hands before you touch your face. And just have that hand sanitizer in your pocket and use it. It can sit in your pocket, and if you don't use it, you'll get sick.
This is something we haven't talked about yet. Kathy Haslam, I'm sorry if I butchered your last name. When they say this affects older people, more exactly, how old and all older or older people that are not healthy? So I think she's asking, is it only affecting older people who may be immunocompromised as compared to someone who is healthy, doesn't have a history of cancer or diabetes?
Right. So we think that coronavirus is going to affect people age-wise over 60 more than people under 60. And that is because in most people, as we get above that age, our immune system naturally starts to weaken unless they're unusually healthy. For people of any age who have a weakened immune system, they also are more likely to end up in the hospital if they get the coronavirus. They may not. They may get a mild case just as well. It depends upon what type of weakening of the immune system. So we have people who have a very mild weakening of the immune system because maybe they're on some medications for arthritis that are great for treating their arthritis and other medical conditions and slightly weaken the immune system. Compared to somebody who has cancer, who is on chemotherapy, they may have a more significant weakening of the immune system, or somebody who has just had a bone marrow transplant, or somebody who has a heart or kidney transplant. That's a little bit more significant weakening of the immune system. They're going to be a little more susceptible to this virus and all the other respiratory viruses.
So this is a final question that I have personally. If somebody believes they have been infected with the coronavirus, whether they have traveled to an area of risk or not, maybe caught it from somebody here who has traveled, and think they need to see a medical professional, what should they do? We don't want to be walking into urgent cares infecting the public, correct?
That is a great question. And usually, if you're concerned that you've developed a respiratory illness and you're wondering whether it's the coronavirus, you would first check with your own family physician, or in the case of your children, the pediatrician. That person then, if they think that there is an indication to do the testing for coronavirus, they would then contact the health department. And still at this point, the health department is approving whether tests are going to be run or rejected. If you are mildly ill, the test will probably not be accepted. You have to be sicker, probably in the hospital with a respiratory illness before the test would be run. Now that is right now. In the future, as the test becomes more readily available in hospitals or at reference labs where the hospitals can send these tests to and not overwhelm the state labs, that we may be able to see testing of people who are not sick enough to be hospitalized, but that's just not the case yet.
We have a viewer, Annette Courier, just coming into the broadcast. And this is something I should have asked you about earlier, Doctor. I apologize. What are the symptoms? I know they are similar to flu. Can you talk a little bit about that? What might be different, what you should be watching out for compared to the flu?
Well, unfortunately, there are no specific symptoms you can watch out for to distinguish coronavirus infection from the flu. The symptoms are pretty much the same: fever, coughing, headache, congestion, feeling achy. Not everybody gets all those symptoms, but they're the exact same symptoms as the flu and the other respiratory viruses. So doctors will not be able to tell the difference based upon your symptoms.
Doctor, is there anything I forgot to ask that our Facebook commenters forgot to ask that you think is pertinent information to get out there about coronavirus right now? We have these 2 confirmed cases, once again, in Hillsborough and Manatee counties. Is there anything that we forgot to talk about?
No, I think they asked us great questions and covered the topic very well, but I would just like to say, don't panic, because it's not as bad as it sounds. If you're not worried about the flu, don't worry about the coronavirus. You should worry about the flu, and just be conscious of how often you touch your face and clean your hands frequently.
All right, everybody, this has been our 8 on Your Side continuing coverage about the coronavirus. I want to make sure you and your families are safe. Doctor, I want to thank you so much for coming in this morning and taking the time to speak with not only us, but our Facebook viewers.
You're welcome.
All right, guys, we will be live again today. We have a 10 a.m. press conference at Sarasota Memorial Hospital. I know we will be back live on WFLA Now for that. But for now, I'm WFLA digital reporter Daisy Ruth signing off.